The battle over repealing the health care law occupied much of the national political agenda this year. The individual mandate for coverage was repealed through the tax bill starting in 2019. But Republican efforts to repeal the expansion of Medicaid failed, at least for now. Yet even as that debate played out, voters in Maine overwhelmingly approved a ballot measure last month to expand Medicaid there to most low-income adults. The victory has reinvigorated advocates looking to expand Medicaid in other states. But as special correspondent Sarah Varney reports, the battle is not yet over in Maine. Our story was produced in collaboration with our partner, Kaiser Health News.
I know. You're welcome. Starving you to death.
Donna Wall cares for her 3 adult autistic children at her home in Lewiston, Maine. It's a full-time job. Her sons Christopher and Brandon have frequent outbursts, and the stress of tending to them can be overwhelming. When her sons turned 18 a year and a half ago, Maine's Medicaid program dropped her health insurance. Wall is considered a childless adult in Maine and other states that didn't expand Medicaid, and so she isn't eligible for coverage. She can no longer get her antidepressant and anxiety medications. She can't see her psychologist or a doctor to check up on a troubling spot on her eye. She needs to stay whole, she says, for her kids.
I'm 60 years old. Things start going wrong when you get older, and I haven't had a pap smear or breast exam in 2 years. I just worry something will happen to me because who's going to take care of them? It's a big job. It really is. I mean, if I put the boys in a home, it costs the state a lot more to take care of them than it would be to pay my medical.
Even on frigid, wintry nights, Wall delivers newspapers, earning $150 a week when her kids are asleep.
I go out about 2 in the morning, and it usually takes me 4 to 5 hours. And I try really hard not to fall, but I've had a few accidents. One of them was on black ice last winter. You want more, Brandon?
At one point, Wall thought she might have broken a rib, but she stayed away from the emergency room for fear of a costly medical bill. At least 70,000 low-income Maine residents like Donna Wall should gain Medicaid health insurance because of the ballot measure that passed last month. Advocates collected signatures to put the question to voters, and in November, Maine became the first state to get approval at the ballot box to expand Medicaid, passing with 59% approval. But even though voters here in Maine decided to expand Medicaid, the law's fate is still unclear. Republican Governor Paul LePage says opening up the program to more poor adults threatens the state's financial stability, and that lawmakers shouldn't raise taxes to pay for it.
You have to pay for the law. It's going to cost money, and I intend to implement it, and the legislature is required to fund it. If they do not fund it, it will not be implemented.
LePage has been in power for 7 years, and because of term limits, is heading into his final year in office. He vetoed 5 Medicaid expansion bills passed by the legislature before voters approved it at the ballot box. LePage says lawmakers must now pay for the new law without raising taxes or dipping into the state's rainy day fund. And he warns that the expansion could threaten services for people with disabilities and the elderly.
When able-bodied people who are able and should be working choose not to work, then I don't think it's society's responsibility to cover their insurance at the expense of our mentally ill, our disabled, and our elderly. We're asking hard-working Maine families to pick up the extra tab for people who should be working but elect not to be.
Well, that's just simply not true.
Sarah Gideon, a Democrat, is the Speaker of Maine's House of Representatives.
Let's start with the population of people who will actually be eligible for health insurance now. We're talking about people, almost 70% of whom are people who are actually in the workforce, who are earning a living, but not actually able to afford health care with the low income that they earn.
Gideon says LePage must follow the law. Moreover, she's confident the legislature will find a way to fund the state's share of $54 million and keep its promises to the elderly and disabled.
It's not a choice between people, one group of people over another. It's a false choice that this governor is trying to present. And we say, we're not going to make that choice. It is the law, and we're simply going to make sure that that law is implemented.
Our rural hospital is struggling. We don't make money. We lost $1.5 million the last 2 years.
Marie Vino, CEO of Mayo Regional Hospital in Dover, Foxcroft, says money from the Medicaid expansion can't come fast enough. Maine's rural towns and their hospitals have been hard hit. Factories have closed, and many residents have moved away.
We're going to go by what was Moosehead Manufacturing. They made furniture that was very well known throughout the country as well in Dover. And then, of course, paper mills were huge in all of this area.
As workers lost their jobs, more uninsured patients turned to rural hospitals, desperate for medical care, but unable to pay. While Mayo is facing financial uncertainty, at least 3 rural hospitals in Maine have closed in recent years. Deanna Chevry was laid off after 25 years when the Dexter Shoe Factory closed in Dexter, Maine. Now 60 years old and uninsured, she's recovering from an addiction to pain pills prescribed by her doctor for back pain. She overdosed 5 times, costing Mayo Regional Hospital over $200,000 in unreimbursed care.
You're welcome.
Before Chevry found the Charity Recovery Program at Mayo Regional, she says she was turned away when she sought help because she couldn't pay.
You only can go so many places, nobody will take you. I mean, they don't care if you're crawling on the ground. I'm just fortunate Dover helps me.
But Vino says the hospital cannot keep up with Maine's growing opioid epidemic and ever-rising costs without expanded Medicaid.
You can only go so many years in a row where your business doesn't lose money before you depreciate to the point that you have to start closing services, decreasing services, and then access goes away.
Medicaid advocates like Maine Equal Justice Partners are pressuring lawmakers to put the new law into effect quickly.
The law is on our side, the facts are on our side, the reality of people's lives are on our side. Did I say the law is on our side?
Victoria Rodriguez says people like Donna Wall with her autistic children need help quickly.
It's really stressful to hear these stories from people who are literally just one accident away from being buried in medical debt, and their families being devastated by that.
The group has been receiving postcards from around the country congratulating them on becoming the 32nd state to expand Medicaid.
So this one's from Virginia. Greetings from Virginia. Thanks to y'all for your efforts. The majority of voters in Maine have resoundingly improved expanding Medicaid for 70,000 low-income people. Wahoo!
And advocates in many other red states that refuse to expand Medicaid are eyeing their own ballot measures, including Nebraska, Utah, Idaho, Florida, and Missouri.
What you're seeing is health care is, a popular issue. And
Patrick Willard, a senior director at Families USA, a progressive advocacy group based in Washington, says after years of Republicans attacking the Affordable Care Act, voters are beginning to shift their views.
What we've heard is that other states suddenly see an opportunity now to figure out a way that they can get around legislatures that have been holding this up.
We now know the effective date.
As state lawmakers in Maine work out the details of the new law, many disagree with LePage about how much it will cost. His administration estimates the price tag will be twice what the legislature's nonpartisan fiscal office has projected. LePage says if they can't resolve the impasse, he'll take legal action if necessary.
We will go to court because I know, listen, one thing that I know better than a legislature is financial responsibility, and I have proven it over the last 7 years.
Advocates say those who are eligible for Medicaid could enroll as early as this summer. But if there are delays, they too will sue.
Did you put your cup, Chris?
Just days after our interview, Donna Wall fell during her middle-of-the-night paper route and broke her ankle. She still doesn't have health insurance and is unsure how she'll care for her autistic children and uncertain what the future will bring. For the PBS NewsHour and Kaiser Health News, I'm Sarah Varney.